actually, when Roosevelt was president in the late 1930s, 1940s, he did the big change called the New Deal, but he did not address health care. He started our Social Security for the older people. He did lots of different things, but he did not address health care because he was worried about the political fallout, the political problems. And so after Roosevelt died and the war was over, in 1945, the president was Harry Truman. And he tried to get national health care. He tried very hard, and he was defeated. Two groups opposed him. One were the American doctors, called the group is called the American Medical Association, the AMA. And they used to be very powerful. They are not nearly so powerful today as they were in 1945. But the other group that opposed President Truman were the people, the senators and the representatives from the states in the South, in the southern U.S., because they were afraid that if we had national health insurance, we would have integrated hospitals, because in those days, black people in the South went to different hospitals than white people. They kept them separate. And during the war, during World War II, was the first time that in the Army, black and white people were served together, sometimes in the same unit, sometimes separate units. And so we were starting to move towards integration, and they did not want to have integrated hospitals. And so Truman's plan was shot down. And so we developed this plan. No one ever said we should develop a plan and it should work like this. Instead, it just kind of happened. And it changed in little ways, this way, that way. And now our system is like a patchwork quilt. It is just a crazy mix. Never been really planned and organized. And so we have all these insurance companies who fight with each other, not to give better care, but they compete by trying to avoid taking care of sick people. That's crazy. If you do not have insurance, you have two ways to get it. One way is to work for a company that offers insurance. But if you're self-employed, if you're a farmer, if you're an artist, on and on and on, then you can try to get insurance as an individual. But if the insurance company thinks you're going to get sick and need the insurance, they will not give you the insurance. That is crazy. But that's really how our system works. I'm not exaggerating. Medicare is not perfect, but it works pretty well. And people age 65 and above get pretty good health care in this country. It's the people in the middle who don't work for a company that provides health care. These are the ones who are caught here with 47 million people with no insurance. And so if they come to see me in the emergency room, you know, maybe they're going to get a bill for $200, $300, $500, $1,000. So they don't come until they're really sick. You know, they don't come until they're very sick, and then the bill is $5,000. Yeah, and then they go bankrupt. They are financially ruined because they've got this big bill and they can't pay it. And so they go into bankruptcy where they can't pay any of their debts, they give up their house, they lose their car, they lose everything. If John McCain is elected, I don't think we will see a change, because John McCain has made it very clear, his feeling about health care is that even though he says some things about we want to expand health care, his health care plan would, by the best estimates, would cause another 20 to 30 million people to lose their health insurance over the next 5 years. That's a lot of people. So McCain's plan is crazy. McCain's plan is probably the most radical change in healthcare that any presidential candidate for one of the major parties has advocated in the last 50 years. It's a very radical plan. People don't understand how radical his plan is. Obama's plan is not perfect. I don't think Obama goes far enough to really cover everyone, but I think it's a good step in the right direction, and I think it is actually much less radical a plan than McCain's. McCain's is a very radical plan. I think, and the reason we call ourselves Hoosiers for a common sense health plan, you know, common sense, simple, make it simple. Our plan is we have had our program, Medicare, for everyone age 65 and above for over 40 years. It's not perfect, but we should just use that as our basis and expand that to cover everyone under Medicare. That's what we think is the simple plan. And so
how it works? How many money people have to pay to go in this plan? Nothing?
Well, in Medicare, you pay some taxes for that, and you pay some premium for that, so you pay something for it. But Medicare already takes care of the elderly, who are the most expensive, the most difficult to take care of. And when I see a patient with Medicare, I send a bill to Medicare. They pay me back. They don't pay me as much as some insurance pays. They pay more than other insurance pays, and they pay a lot more than no insurance pays. Today, the big people opposing it, number one would be the insurance companies because they are so strong and powerful. Number two probably would be the drug companies, the pharmaceutical industry. But the drug companies, even if we make the most ideal changes in our system, the drug companies will do fine. And they will, you know, they operate at a profit in every country around the world. They're profitable in France, they're profitable in England, but they don't want to change things. They're afraid their income may go down. So the drug companies will fight it some, but the insurance companies are the big battle. And the insurance companies didn't used to be so strong before, but what has happened is now the insurance companies have, there used to be lots and lots of little insurance companies. Now they have coalesced, they've merged into huge, powerful companies. So they are the big ones we have to battle with. So it's a different battle than it was when Truman was president.